Hello, I'm Dr. Brad Vazalis, cardiothoracic surgeon, intensivist, and founder and CEO of EndoClear LLC. Our company is committed to improving the management and clinical outcomes of critically ill patients. Today, I will be reviewing the use of the EndoClear Restore 2, a pneumatically expandable endotracheal tube cleaner that removes the secretions and biofilm precursors that routine closed suction invariably leaves behind. In use, the expandable wiper is inserted to the correct depth within the endotracheal tube. It is then deployed and pulled back into its disposable adapter. The Restore 2 is a single-patient, single-use device intended for use in adult-sized endotracheal tubes 7 to 8.5. As this is just a clean procedure, sterile gloves are not required. The Restore 2 package is clearly labeled and has a rather small footprint for easy storage. First, the package is opened and the device removed. It comes already attached to a syringe that is appropriately sized for 7 to 7.5 endotracheal tubes. If the endotracheal tube to be cleaned is an 8 to 8.5, then the syringe labeled 8 to 8.5 is substituted. To test the device, first, the syringe is pulled all the way back. This fills the syringe with the predetermined volume required in order to clean that size tube, which in this case is an 8.5. The syringe is then depressed all the way, and the distal end of the device is reviewed to assure expansion. Next, the closed suction system is disconnected from the endotracheal tube, and the Restore 2 adapter is inserted. The closed suction system is then reconnected to the adapter. The patient is now again being ventilated, and any time pressure for completion of the cleaning procedure has been eliminated. The Restore 2 is inserted until the centimeter markings on the catheter match up with those on the endotracheal tube. This assures that the Restore 2 tip is positioned just outside the endotracheal tube. The tip itself is composed of a rounded soft silicone so as to be as atraumatic as possible. Also, the overall length of the device is limited so that it cannot protrude more than 1.5 to 2 centimeters beyond the endotracheal tube tip. Once appropriately positioned, the operator waits until a breath has been delivered from the ventilator, and on patient exhalation, the syringe is fully depressed, and while firmly grasping the adapter with the other hand, the Restore 2 is pulled back completely into its adapter. This should take approximately 3 seconds. If difficulty is encountered in the pullback, allow the syringe to reset by releasing the plunger. Pull the device back 1 to 2 centimeters, recompress the syringe, and again attempt pullback. If severe resistance is again met, release the plunger and withdraw the device. At that point, fiber optic bronchoscopy should be considered to evaluate for a severe and potentially irremovable ET tube obstruction. The adapter and Restore 2 are removed as a unit and disposed of according to hospital policy, and the closed suction catheter is reconnected. The adapter can be separated from the device and sent for microbiologic evaluation as a tracheal aspirate if so desired. The Restore 2 may be used in PRN fashion in patients exhibiting findings of endotracheal tube narrowing, such as increasing ventilator resistance, increasing peak airway pressures, sawtooth flow pattern, thick secretions or blood, and certainly if there's difficulty passing the suction catheter. Interventional clinicians have also found Restore 2 use just prior to bronchoscopy is beneficial. It makes the artificial airway as large as possible and prevents the bronchoscope from pushing endotracheal tube secretions down into the peripheral lung fields. But the greatest benefit from use has been found in the daily protocol use after 24 hours of intubation and to clean the endotracheal tube just prior to the SBT. The protocol use has resulted in decreased average length of intubation and decreased direct cost for caring for these sickest patients. EndoClear, safer airway management, better patient outcomes, and lower hospital costs.